Board of Health meeting, opening ceremonies. Let's do a pledge of allegiance.
To the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Thank you all for that. Thank you. Thank you. Roll call, Ms. Teresa.
Commissioner Matthew. Commissioner Hoffmaster.
Here.
Commissioner Houts.
Yeah.
Commissioner Leininger.
Here.
Commissioner Baker.
Yeah, I'm here too.
Commissioner Lanius.
Here.
Thank you.
All right, very good. Thank you all for your time this morning. Can I get approval of the agenda?
Make a motion to approve the agenda as printed.
Steve got in there just in the nick of time.
The two guys that are leaving.
Well, Preston's not going anywhere.
Keep this meeting going.
All right, we have a motion and support. All in favor of the aye? Opposed the same. Motion carries. Approval of the minutes. Everybody's gonna check.
I'm gonna move to approve the
And I'll support you.
We have a motion and support. All in favor of the aye? Aye. Opposed the same. Motion carries. On to number 2, public comments. We have a standing room only this morning, which we appreciate.
There's new chairs.
Yeah. Okay, seeing no public comment, move on. Health Officers Report, page number 6. Miss Rebecca.
Good morning.
Good morning. How are you?
Good, thank you. So we're going to start off today by thanking our Board of Health members. This is the end of a 2-year appointment to the Board of Health, and we want to express our appreciation for your service to public health. We do have cake, so please have some, and Rusty graced us with donuts.
Thanks,
So
Rusty.
please
Nice,
enjoy all of our treats today. Today on the agenda is budget amendment number 1 and a salary adjustment proposal prepared by Teresa for today's meeting. The budget does take into account all known and expected revenue at this point in the fiscal year. And it's a balanced budget, does plan for a 5% salary adjustment for staff, which is recommended after review of wage studies, which show agency lagging behind other local health departments and a consideration of the inflation rate. There is a projected use of fund balance in this budget. Personnel policy updates. The Personnel Policy Committee has been working to review and suggest changes for the policies. Those proposed changes were reviewed by the agency's attorney. He made some comments. Those were included. It was reviewed by the PPA committee and moved forward today for adoption. There was one piece that the attorney had included, which was the sick leave, which could still be happening in February. The PPA committee asked to let's leave that aside for now. If we need to act on that, we'll act at the January meeting so that it's in place in time for the February deadline. So if any of you will be back with us next year, we may be acting on it at the January meeting. Also today is the proposed Board of Health meeting schedule for 2025. It does include the meeting recommendations for committees as well as the full board. As with this last year, we are meeting on the 4th Thursday of the month, January through September. We take October off, and then in November and December, the 2nd Thursday of the week. The committee meetings are also outlined in there. Obviously, with some potential new members here on the board, at this point, it's our best guess. Open enrollment. The agency is currently conducting open enrollment for benefits for the calendar year of 25. Our insurance provider, Alera Group or Lighthouse, has made an electronic benefit system available for staff, so they no longer are filling papers out and submitting those to our human resource department to actually go onto the electronic portal and select their choices and then finally submit it. And that's how that's going this year. It's been going quite well. Most of the staff have at least been in there, and they have to register the first time they use it. So most staff have been in there and registered. At least half, I think, have completed enrollment at this point. and the rest of the staff are in some point. It is respiratory virus season. We continue to encourage residents to receive their flu and COVID vaccines, and if recommended by their provider, the RSV vaccine as well. The that we've been talking about since we took on Hedgehog software is now live on our website, and Joe's going to demonstrate that today when it's time for his report. We have some nursing positions open, the mobile nurse, a part-time communicable disease nurse, and a part-time hearing and vision tech is also open. And in area agency on aging, we're seeking a nurse case manager. Beacon has mostly wrapped up their community health needs assessment at this point, and we are continuing to work with them as a partner agency to move forward the needs that came out as a result of their CHNA. Lots, as you may know, probably if you're paying any attention to the legislature, we're in the lame duck, and there is a lot of movement right now going on. MELF, the Michigan Association for Local Public Health, is continuing to follow a number of legislative items, of which includes Senate Bills 299 and 300, which we've been talking about for quite a long time, that deal with a statewide septic code. Those did get moved out of committee yesterday. The House needs to introduce a bill today, or it all dies and
Well,
no.
Those would have to be passed by the Senate. To me, lay over the House to enact that on Wednesday of next week. They are listed in the Senate. You look at the bill today on the legislative website, it says it's showing the bill in the Senate Journal today being on third reading of a bill. So indication that there's probably going to be action on those bills in the Senate.
I knew we were in that 5-day window, so yes, thank you for that.
But right, they don't have to, those bills would have to be introduced in the House today or to meet that 5-day window for action.
5 o'clock today.
No,
Midday.
well,
Gotta be days.
correct, no, the House adjourned last night at 10 o'clock last night, just after 10 o'clock last night. Routinely, you get into lame duck session, the legislature will adjourn at 12:01 or 12 midnight and reconvene at 12:01 a.m. and go on into the next day. So there's a possibility that the Senate could go into tomorrow morning if need to get those passed. I don't foresee that because the Senate's been operating a lot more functionally than the House has been. But if those get passed, even next week, the House could, work all day Wednesday, adjourn at midnight, reconvene, 12:01 a.m. Because they have to start a new day, they have to adjourn and reconvene and still enact those next week, Thursday.
You actually stayed up.
No, I fell asleep listening to it, John. I did get up and finally looked at their journal about 7:30 this morning when they finally got that online to know what time they did adjourn, so.
There were some changes to the bill before it came out of committee that are good changes. But who knows what it'll be like at the end of the day. So. Billing for community health worker services. So we've been struggling to get paid to pay on the bills we submit for community health worker services. We are continuing to work through that. We actually have an MDHHS staffer who's now collected some information and is going back to Medicaid to work on why that's happening. So I'm really hopeful for some resolution, but we will see. Wanted to mention a couple of public health concerns. Pertussis, for one, it's common in the United States, and while it can cause serious illness in people of all ages, it's most dangerous to infants, of course. Cases of pertussis in Michigan continue to be high, and it is a vaccine preventable disease. So we continue to see declining childhood immunization rates, leaving more infants and children at risk for severe pertussis. Human arbovirus illnesses, I am including the next couple of pages here, the summary to date that I thought would be of interest to you. I know at this point, it's cold enough outside that killed off the mosquitoes and the ticks are dormant. So we will probably still see some human cases, but hopefully that's slowing down for the year. As the administrator for the county is retiring, Teresa and I met with the incoming county administrator. His name is Frank Walsh, which John would know. We met with them yesterday. It's the first time I'd had the opportunity to meet Mr. Walsh. So we did talk a little bit about the HVAC upgrade that we've mentioned going on in this building. That work is scheduled to happen in the spring. And then we also talked about some of the finishes and the counters for the bathrooms and the clinic counter. And that work will also happen in 25. So. At the Hillsdale office, we are continuing to collect some additional information regarding water softener that was discussed last month. I expect I will have that information for January. And the insurance claim, we shared that with the finance committee. At this point, we have let the construction company know they can do that. And so they're working to talk with MCDC to work out a schedule that works for that clinic. In Sturgis, I've been talking about a floor installer that needed to come out and repair a floor tile. The landlord is aware. No resolution to that yet. We do have an electrician coming to replace ventilation fans that are not working in restrooms at the Three Rivers building, and a plumber coming out to replace a broken valve on a water line. And Board of Education is complete for the year. We start the year. That's my report for today.
Very good, Madam. Thank you for that report. Any questions from the board? All right. Moving on to 4, Medical Director's Report. Dr. Lee Perrella.
Good morning.
Good morning.
My report for the month is in your packet. Most of the focus on the presentation of latent tuberculosis patients and some active tuberculosis patients, which we will talk about in my educational side, and then lots of pertussis questions from local providers. So, yes, we're making for pertussis before, and mostly the issue is we need to vaccinate people, but there are some providers concerned about their immunocompromised patients as well. So even vaccinated immunocompromised patients. So we're getting them some information and going back and forth with some conversations. So
Is this a separate vaccine or is this something that you get when you're young?
you get younger vaccinations. Yep, several of them in a row. So we do have a population that doesn't get vaccinated in all of our 3 counties, and seems to be a big issue with this whooping cough, which we weren't seeing really much of, and now this year it's pretty excessive.
Find a lot of that in the Amish community, or
Yeah. So my educational piece last month, we talked about the fact that we were talking about latent tuberculosis and active tuberculosis, and the distinction between was pretty important. So I thought I'd just start talking about tuberculosis, and it's caused by Mycobacterium tuberculosis, and it's a bacterial germ that you can find other parts of the body getting attacked too. We will have non-pulmonary, but it still remains the world's most deadly infectious disease. So we see some countries with a very high rate of tuberculosis. In 2023, the U.S. had 9,615 cases of tuberculosis, which was an increase from 22. And it is spread airborne from one person to another. So the TB germs are spread into the air when a person talks or sneezes or sings, and then people nearby can breathe in those TB germs and get infected. So anyone can get TB, but the high-risk people are obviously if you're near someone who has infectious tuberculosis. People who are born in countries where TB is very common, Mexico, the Philippines, Haiti, Vietnam, Guatemala, and healthcare workers who work in those situations, especially homeless shelters, nursing homes. So we do see a lot of our latent tuberculosis patients are nurses from nursing homes, and we do have a lot of the immigration issues from we've seen Haiti, we've seen Guatemala, we've seen Mexico. So in our communities. So you breathe in the germs and you can get the infection. So if I'm near someone who has active TB, I can breathe in tuberculosis germs and I can have an infection in my body. I can have the germs, but it can be latent, right? So a blood test will show that I'm positive, but I don't have any signs or symptoms from having that tuberculosis germ in my body. I cannot pass it to other people. So if I have latent tuberculosis, I'm sitting here talking, I cannot give it to anyone else. I also have no idea that I have that, except for the fact that I might get a TB test, a little T-spot, which we've all had probably in school and we get our jobs, or an actual blood test. So latent tuberculosis can then convert to active tuberculosis. So that's a big push now for us, is to get these latent tuberculosis patients treated, because about 1 in 10 will convert to be active TB eventually. So, and if you have HIV, if you're a kid, an adolescent, that rate is even higher. So we're trying very hard to get our latent tuberculosis patients to at least come in for a meeting with me and the nurse. We go over all the risks, we go over the conversion rate, we go over the medications, and almost all of them have elected to be treated. One gentleman in Three Rivers who won't even come in and have a conversation, but short of that, everybody we've talked to has gone ahead and proceeded with the treatment. So the treatment is about 60 to 90% effective. So even if treated, you can still end up with active tuberculosis. So we go over all of those symptoms with them too. And active tuberculosis, as you know, those are the people that are coughing, losing weight, coughing up blood. They don't feel good at all. There's lots of fatigue. So a TB skin test, again, if you have a positive skin test, then you're kind of referred and we look at whether or not you have a positive chest x-ray. So if you just have a positive skin test, that could be latent. If you have a chest x-ray which shows signs of tuberculosis, then you probably have active tuberculosis, and then we proceed with different treatments. We've also talked about the directly observed therapy that we have to do. So when you're taking these medications, both latent and active TB medications, we are obligated as a department to kind of help you take those medications and watch you take those medications. So you can imagine, I'm meeting with some patients this afternoon. There are 4 of them that we hope to get started on treatment. So you can imagine our nursing staff, right? So we've had some people, and it's everybody, right? Heidi's included, all of the nursing supervisors are included, but we have had some of our nurses go to homes every day for weeks, okay? And I went with one of them and it was a job. I mean, it was a job, and she was doing that every day for 2 weeks. So, and then we kind of got them on track, and now they FaceTime. So we can FaceTime in, watch them get their medications, watch them give their medications to their kids, and then that satisfies our directly observed treatment. But we wanted to wait until those parents were really good at giving the medication. So that is kind of the difference between latent and active. So the big issue, people say people are walking around the community with tuberculosis. They probably mean latent tuberculosis, right? So yes, you can be in Meyer and you can walk around the top with your latent tuberculosis. I would love for you to be on treatment if you have that, because you can convert, and then you can imagine what a nightmare that is for public health as well. But you should not be roaming around with your active tuberculosis until you've been on treatment. So usually about 5 days of treatment, you're not deemed contagious anymore.
Is there a specific way that it becomes active from?
There is not.
No way to make
No.
it active, what triggers it?
No, exactly.
Yeah.
Yeah, no way to tell when it becomes active. Yeah, some medications, right? So, and the treatment, the treatment for active, and there are some different treatments, but they're 4-month plans, 6-month plan, 9-month plans. These are not short-term treatment issues, right? So late tuberculosis, we try to steer people toward a 3-month program once a week for 3 months, but it's about 10 to 12 polls once a week. So that's some time watching somebody take their medication, 10 to 12 polls once a week as well. So, yeah.
Thank you for that report. Any other questions?
How long does it take to go from latent TB to active? Could it be like a minute?
It could be pretty quick. Yeah, nobody knows that either, right? Watch people and no one knows.
Because, you know, I think a year ago, some of those latent TB patients were some of the refugees from Ukraine.
Mhm.
And I know some of the kids, those families participating in sporting activity.
Mhm.
I don't know who in the, you know, I don't know. And I know we've had someone like TB in those situations. I don't know who, is there a concern then with those kids involved in sporting event, close physical contact with other kids that, you know, potential for, you know, a change in that status and not catching it quick enough that they could then transfer that to other students.
Mhm. Yes, I would say there's definitely concern there, right? That's why we try to get all those latent TB patients in right away to have a conversation, get started on meds. I feel much better when they're on the medication, obviously. Then they're not, their potential to become active is so much less. But yes, there's definitely that window.
And even if they,
window treatment too, right? Like that I was exposed and then I'm not real sure if I have it and I have a negative test, but you could have been exposed a month before, you know, so we do some window treatment if I think you've been exposed and I'm concerned that you might go ahead and be spreading something to the community, that we do some treatment there too.
if you're latent and you're taking the medication, that doesn't necessarily mean you won't become active.
That's right,
So
yeah,
it's just that, okay, hey,
Yeah.
you do become active, we still have our kids and stuff.
exactly. It's about 16 to 90% of people with latent that are treated or become active. So it's like 1 in 10. So those latent people that become active. So.
What if they're not treated? Is there any cases where they just stayed latent and never?
Yeah, definitely cases where people, you know, the treatment has its side effects, you know, so sometimes people are like, I've already talked about it, I've known about this positive test for years, you know, and they don't want to take the medication. We're really trying hard to get people to take it. Yeah, based on their age and if they're healthy, right? I mean, we've had discussions about 96-year-olds, you know, what do you do there?
Here's another hard hitting question. So is this what Doc Holliday passed away?
Yes, I was just gonna say. Right here.
St. Joseph County, man.
Where are we at for Doc Holliday?
Is it though? Does anybody know the historians?
I didn't know that story.
Yeah, it was.
Doc Holliday at TV.
But
Yeah.
No, you probably know the consumption.
Consumption.
You know,
Like,
the common, the old common terminology is, well, they got consumption.
For Doc was a dentist, it makes sense. Good.
we used to put people in, you know, sanatoriums, right? If you had TB, you were not walking around the community.
really? Kind of buried the lead there, Dr. Luparello. Okay. Starting with that.
Could have started with.
I know, right? Well, he was like, Doc was latent for a while, then
Right.
Wyatt went somewhere and a bunch of people.
Right.
That's the story you don't hear
Fantastic.
behind the scenes of the A&E.
Snickers bar.
Yeah, but Doc Holliday.
Tombstone?
Come on. Why is there? Okay, moving on. Sorry. Department reports. Personal health and disease prevention. Hi.
I did include some highlights from the regional FEs and visits to the ED departments and urgent care are actually running at low levels, so that's good news. Flu activity is also one of the things that we changed recently. We have had an uptick in COVID cases, I've noticed as well. Nationwide, we've had 2 influenza-associated pediatric deaths, but none so far in Michigan. I include a link to the seasonal respiratory virus dashboard. It's kind of nice to take a look and see what's going on with that. On October 18th, the CDC did issue information about the increased reports of mycoplasma pneumonia in children that we've been experiencing. And we already discussed pertussis a bit. I did do a quick search this morning, and just this year in our Tri-County area, we have had 19 cases. Let's see. For HIV and STI, we do have our condoms in each bathroom facility available for the community to go in and help themselves to. As far as WIC, I did attach the most recent WIC participation in food cost document. If we take a look at that, that just kind of shows the amount of clients. This first one right here, the closeout, shows how many clients are enrolled in actually using the benefits. And it also shows the amount of money that WIC has saved our clients. So that's kind of interesting. Branch County is up on that. I kind of think that might be part of the migrant situation we have. Amanda, she was our mobile unit. He is training and being situated in a children's healthcare role. And I know Becky mentioned hearing and vision. We have offered the position of somebody she did accept. So
All right.
that's exciting. Let's see, our COHA is going well. Angie's actually planning to go into a school in Bronson on Monday. That'll be her first school to actually go in and start assessing the kindergartner. So she's gung ho with that. I think that's about all I have for an update.
Very good. Well, we appreciate that. Any questions for Ms. Heidi?
Are we seeing many people coming in and actually getting COVID tests anymore?
But we don't have COVID tests here. We do get a few calls and we direct them to the library and some other, they can order them online, but we don't have any here that we hand out.
So when you say they test positive, is that they test positive at home and then they report it?
Oh, yes, if I get those reports for them. the state
Gotcha.
system.
Okay.
Yeah.
Gotcha. Very good. Well, thank you again for that. We appreciate it. Moving on to health, education, and promotion, Ms. Chris.
Good morning.
Good morning.
Things are busy at Health Education and Promotion. So the Office of Highway Safety Planning grant is going well. We are on target with all of our deliverables for the grant. And we have met with the state's public relation advertising firm to discuss some of their concepts. And my team is actually on a conference call with them now. Again, they are supposed to be providing us with some initial concept art today. We do have meetings scheduled with area bishops in all 3 counties for next week. So there will be a meeting held at the Camden area next week, and then Alganzi Township and Centerville is having a meeting as well. And we have received very good response from bishops in the area who plan to attend. And so we hope to share some of the conceptual stuff from the marketing with them to see and get their feedback, whether they feel it's appropriate, and just making sure everybody's comfortable with what's there. In regards to Beacon Health, as Becky mentioned, we continue to finish up that project. Part of that project was promotion of our WIC program and immunizations and a marketing campaign. And during November, our marketing campaign reached 16,459 individuals and had 85,788 impressions in St. Joseph County. So we're very excited about that. I do want to correct that our incentive program for WIC clients is going to finish on December 20th, not December 31st. We did hold the first planning committee meeting for the Hillsdale County opioid educational activity. That was on last Friday. We are continuing to move forward with that, and we'll be setting our next meeting for sometime in January. The medical marijuana grants will be due at the end of this month. They have to be submitted on New Year's Day. So we will be reaching out to the county administrators. We have the draft grant pretty much done with all of the objectives and the activities. Working on budgets right now. My goal is to have those grants to your county administrators by next week, Thursday. So if you would like to assist us in ensuring that they're done and filed by December 31st, that would be great. The distributions anticipated for each county are listed in the report. Those are all up slightly from what we've seen previous years. So,
And how does that get?
it's based,
Who gets what?
so it's based on the number of renewed and issued medical marijuana cards.
Good job, Branch, didn't I?
Mm-hmm.
So
Okay, less drug addict.
The annual agency all-staff meeting has been scheduled for Friday, April 25th. It will be at the ProMedica Conference Center. Of course, the Board of Health is more than encouraged to join us for that day. Apparently I didn't finish my sentence there, but right now on the agenda, we will be covering quality improvement and the milestones that we've made this past year. We'll also be doing a presentation on the neuroscience of stress and how that affects the brain and self-care around brain health. And then we'll have our annual staff awards ceremony. That will be held at the end of the day. Typically starts around 2:30. If you are unable to attend for the rest of the day, if you would like to attend for the staff awards, just so that you can congratulate our staff who worked hard. As far as media coverage, we had 7 news stories that mentioned the agency during November. Our environmental health team went out and did a radio tour across 3 counties around food safety for Thanksgiving. And our team from the AAA Veterans Advocate Program last week did a tour across Branch and St. Joseph counties around scams of the elderly. And of course, our social media topics are there for your review. The Community Health Worker Program is doing well. Ali Salim has left the organization, and so Lisa Redmond is currently working as our only community health worker. But even so, in November, she was still able to complete 21 face-to-face appointments, and our areas of greatest need continue to be insurance between Medicaid applications and insurance options in the marketplace, helping families with getting funding for home repairs, homelessness, or risk of homelessness, and finding financial resources through DHS services. And we'd still continue to see referrals from other partner agencies to the program. Pretty much every day, Lisa's getting connected with another program to help another family. So it's going well.
Awesome. Well, thank you for that report.
So the grant, are to our administrators next week, right? So
Yes, my hope is to have the grants into the administrators' hands by next Thursday, and that will give them until the 31st to get them signed, and they have to submit them to move for the
we're just winding down after Tuesday, so I imagine administrators have stuff to do after Tuesday, but Skeeter.
Yeah, well, and even if I can just get them to sign it, we'll submit it. I think that's how we've done it in the past. So as long as I can get a signature before December 31st, I'm
They
good.
cookies over there and they make sure.
Everybody's
They
fine.
all work with
Let them, sure you guys already did this.
they all work with us very well. We typically don't have any issues, but just wanted to put it on your radar screen.
Thank you.
So
Any other questions for Chris? All right, moving on. Environmental health, Joe.
Morning.
Good morning.
So what we've got going on in EH, we've had a couple new restaurants over, one in Hillsdale, St. Joe's Pizza. I actually got to do that one as an opening. It's really, really cool. They redid, it's a downtown building. They redid it inside, real classy. They built the wood-fired pizza oven on site because it's so large. And so the way they did it was really, really interesting. They capped it with copper. It's really cool. And they're a young couple, so check it out.
How was it? Was it good?
No, I didn't get to try. Just get to open them and say
Come on,
good luck.
Joe. You get to work
so
on
Brent,
it.
that's your task. You gotta do a taste test.
Open them up, we could try.
They're not open enough.
Not yet.
Yeah.
No, what are they, Thursday, Friday, Saturday, I think is it?
Oh, that's rough.
And just, yeah.
Well, try on a Thursday, Friday, Saturday.
Yeah.
I have kids and sporting events and stuff, Joe, yeah, and I don't happen.
No, I live that same life.
Yeah.
So no, I totally get it.
Wait for your word, Joe.
Zay and Zeb's Pizza in Centerville, small pizza place that got open. I wasn't part of that. My staff was that kind of a turnkey thing that they got going. As Chris alluded to, myself and a lot of my staff were able to participate in the holiday safe cooking radio tour. We enjoy it. Some of my staff not real used to talking on the radio. We're totally nervous about it, but it was a good experience to step outside your comfort zone. They did a great job, so that was a good thing. general staff, we are still participating in trainings and we're not gonna stop. We're gonna keep training our young folks up as best we can. We've got 4 trainings-ish coming, just starting in January. We've got MSU's doing a well service up there, or well training. There's gonna be groundwater. It's gonna be great. We're getting a lot of training opportunities there. Kyle's been working diligently on updating our pool policy so that we've got continuity between all 3 counties, making sure we're doing all the same thing. And a big part of the next year is going to be revising our policies to make sure they're working for us. So we're doing that. Our quality improvement project, I'm happy to say, is ahead of schedule. We were hoping to have that all done, everybody trained up on front desk clerical duties by the end of this month. Everybody has had initial training at this date. Some folks have to go back and get some touch up, which is fine. We anticipated that, but we have some folks that think maybe retiring in the future, and this is really going to help us out staffing the front and making sure we're still moving smoothly. Another thing I wanted to share with the board, we had been dealing with an issue in Montgomery with a septic system that had failed, and it was drawn out and contentious at times. And we got a letter from one of the homeowners thanking our staff and the health department on the job that we've been doing and congratulating our staff, Olivia Jacobs, working with them on the situation. So it's trying to make sure you get the funds and pulling permits and things like that. I just wanted to share that the community appreciated, and this person really appreciated the work that our staff puts in. And our staff does a really good job. They care. We still have a job to do, but you can be caring about it, I guess is what I'm trying to say. Sure. So I just wanted to share that. That was a big deal for a young sanitarian to say, oh, okay, I'm doing something right. So it was really encouraging, and it shed a very positive light on all of this. So now we're going to move on to the portal. So this is something we've been working on for quite some time. This portal is going to allow the public to access online services, pay for permits, things like look up inspections, look up your well and septic, track how your application's doing. All of that will be done through the portal, and I plan on doing a much more thorough dive into it later. But on our webpage, there are 3 places you can go to get our portal. You can go to the little well and septic water droplet. Just click on it real quick. And the very top blue box, it says new online portal. You can get to it that way. You can click on food safety and it brings you to the same page. Online portal. What's that?
I noticed they're staring at this one when they can turn around.
Oh yeah,
it's pretty much closer to them.
And then the other way you can go about it is at the very top under environmental health on the top of the bar. You click on it and it brings it up also. So when they click on the blue box, it pulls them right to our portal. You can sign up, make yourself an account so that you can pay for things and manage that account that way. But if you're just interested in looking at certain things, you can go ahead and click on any number one of these boxes and it'll take you to that specific area. For example, if you want to look up restaurants and see how they're doing, you click on food. And I'm just going to sort this by date very quickly so that way we can get to one that I re-looked at. The Post. Burn Allen says it has infractions right here, a little green check. You can click on it and it will tell you what those infractions are and what our staff saw. If you're interested about your sewage records, you can click on sewage records and then go on down and search and find your location. You'll be able to pull up, if we have information, it'll pull up your permit. It'll have everything on there. I can quickly. So here's the septic permit for this location. Goes through all of our paperwork, the drawings, measurements, all that fun stuff. It's accessible to folks. And then also, once you sign in, you'll be able to do the account stuff. So that's just a real quick overview of what's going on. Please check it out. It's going to be a useful tool, I think. So,
You only went out there the other day.
did you? What'd you think?
So when you go into one of those things, and I don't have didn't create an account,
Mhm.
but when I, let's say I wanted to look at sewer system or well stuff. If I did let's say, and I don't want to look at them for the entire agency, but there's some that I'm looking, it's like some of the zip codes out there, and it's like, why are they even in there? But once I did if I narrowed that search down and I looked at it, and I wanted to go, went back, it doesn't keep that search criteria
No, it doesn't.
there,
No,
which is frustrating, I guess.
it is frustrating. It's not the perfect system, right? But it is a system in which we were able to do this. They continually upgrade this. So as we find bugs, we're sending that up to them saying, hey, can you do this differently? And there are other counties that have this program as well that are doing the same thing. So as there's a new iteration, they will update that and it gets cleaner. So that's something that we can get up to them and say, hey, can it save the filter so that when you go back, it's still there and you don't have to start all over? That's something we can do easily.
Okay.
Would it save it if you created an account?
I haven't tried that yet. That's a good idea. Let's try that this afternoon.
Maybe.
Maybe, yeah. And I guess, maybe on the Board of Health side, if with this system, and maybe just create board of accounts for the Board of Health members. So if we have a constituent reach out to us, we can maybe review some of those things a little easier there.
Oh, absolutely. And it also takes it, if that's the case, if it works that way, you just have to click sign up, make an account for yourself, and you got it.
Okay.
You don't have to, there's nothing special.
Be paying for any.
Correct. There's no payment to do that. Anybody can sign up and make an account. I'm not a resident. And I don't have a septic here, but I have an account. So you can all do that. That's not.
So from that, Joe, you'll be able to track all the complaints and everything also, right?
Potentially, yes. We haven't gotten that far because it's brand new. People would, so if you go down here and click on complaints, it requests that you call us because it's just an easier way to go make sure we're getting legitimate complaints, not just I got fired and I'm angry. Because we do get to be honest, people get fired and well, there's retribution. I'm gonna get them in. We have to kind of suss that through that's difficult. And using this system, it'd be very difficult to do.
Good. Any other questions for Joe? How are we promoting? I mean, this is a really neat feature. So, us as commissioners can go back, but we have limited reach, obviously.
Right.
Is there anything that we're doing from an organization standpoint?
This is a very soft open.
Yeah.
We're not plugging this out there yet. Chris and I have had some talks about how we think we should go about doing this. I see more people using like YouTube and things like that to research stuff. I think we could do YouTube videos to where we could promote it that way off of social media. People follow us quite a bit on there. That's a good way. Another way is to send out make a recording with a QR code that Chris and I are talking about and send it out to all of our food establishments and all, let's say, our well drillers that we work with all the time. So that way they have an idea about that. They click on the QR code, take a picture of it, takes them to the video that we produce that shows them how to walk through it. Because once it's out there, the restaurant operators and things like that need to be aware that it's more accessible than it has been.
And all that information's out there.
Not that, if you're doing it right, you don't have anything to worry about anyways, but.
Right. So there can be some accountability there, which is a good thing.
Yep.
And we wanted to do a soft launch because it's new to us.
Yeah.
And we want to just kind of put it out there and just see who uses it. And then if there's problems, they can let us know how it's fixed before we go about doing, a big splash.
So when someone clicks on this to make an account and purchase a permit, it's going to come across on our dashboards to all of our clerks differently than anything else. So when it does pop up, they're gonna go, it's that, and they're gonna click it. And we have to make sure that our processes are the way we train.
Good
So
on the
when you
back.
click on it and it does what it's supposed to.
Yeah.
We did a test run. Actually, Justin and I did a test run to make sure that the payment feature worked. We made a payment. I purchased a permit and payment went through and then we refunded it. So we know that end.
That way. Yeah.
So we're fairly good.
Good. I like it. I think it's good. I think it's good for the residents, certainly. Keep us updated on how well that kind of goes.
We can do that for sure.
Awesome. Moving on. AAA. Miss Laura.
Morning.
Good morning.
Ashley Ellsworth, our Bureau Aging Network representative, was really hopeful to be able to feel safe enough to come down this morning, but she ended up sending a few comments that I'll share as I incorporate them into the different parts of my report. So she wishes everyone well and a happy holiday season. Our Services to Victims of Elder Abuse program is moving right along. The holiday scam campaign, which is sort of an acknowledgement and a promotion of a national campaign called Home for the Holidays, that Chris and her team helped us work on to develop and sort of personalize locally. It also allowed us the opportunity to talk on the radio, which our two victim specialists had never done. But Chris prepared them well, and they had some great responses and had a really nice job doing that. So if you haven't yet, check out the social media pages and or our website to look at the 12 days of scams. We've also begun some additional collaborative work with our neighbors over in Region 2, Wellwise. We really have worked closely with them on their Safe Haven project, and they've worked with a funder to try to expand this statewide and have asked us to participate in some best practices in consulting work to get more programs and elder abuse prevention and housing and homelessness addressed with these programs, because we're all seeing a rise in the need for affordable, accessible housing, and there's just such a significant lack of that. So our organizations are working together, which is always better than solo, and trying to expand this in the state. 2025 budget update, and Ashley did send a few comments related to this, even beyond when I prepared my report. So currently we're under a 3-month award through the end of December, but they're expecting at the Bureau another continuing resolution to be extending us through late March. So we will all be, and Teresa and her team will be, crossing all fingers and toes. They're working on the internal components of that and what those awards would look like for us. But certainly it's not easy, it never is, but we continue to communicate this with our providers, and they've been very accommodating and accurate in their reports to us to keep their grant requests at 1/12 of the contract. So speaking of quality improvement efforts, our division has a project as well. It incorporates our customer satisfaction survey process with our community living program participants. And we've probably had the best return rate we've ever had with that program. Participants were able to complete the 10-question survey in person with a staff person that could help them and assist them as maybe read them the questions and fill in the right dial button. They could call us or they could go online to do that. So we'll have more of a summary and prepare some more formal information for you later, though. We're still working on that. We are holding on that part-time outreach specialist position for now, which is kind of related to the next update, but the full-time nurse care consultant position is open as well. Let's see. And then related to the No Wrong Door project, Branch and St. Joseph County Commissioners have been hearing updates from our state health insurance program counseling sort of sites, if you will, which are operated through each of the County Commission on Aging offices. And When this very short term or short notice grant funding opportunity went out in early November, we met very soon after the question and answer session, sort of the pre-proposal conference, to talk with our providers about this because this could impact their health insurance program counseling project. And, you know, they really were supportive of the fact that our agency was going to apply, and this has morphed into their communications with the county boards. And so we're grateful to have the trust and the collaboration with our sites. We want to preserve the existing operation of that program at both of the Commission on Aging offices in both counties. And they have amazing staff and volunteers who are so highly trained. They're truly professional volunteers that do this. It's not an easy project to, you know, be trained in and work with individuals to try to navigate those health insurance decisions. So we want to try to keep it as close to the way that it functions moving into and through this GFO and the award, which we hope will come through at the end of January. So we're looking at a regional approach because the GFO itself was very heavy in multiple spots of collaboration and working in a larger region to hit more of the potential Medicare population, as well as bolster efforts for what they're calling in this iteration of No Wrong Door, person-centered options counseling. So it's the telephonic, in-person or over electronic, you know, email and things like that, or even a virtual session could happen with an individual or their loved ones to try to help them make informed decisions about long-term supports and services. So it is very similar to what we've done and been doing. To have a decentralized approach, there will be one lead agency, and we're all contributing narrative to the grant, and have been working very closely to try to determine who, what, where, when, how, as well as data and some other supporting documents to try to just solidify this 5-county sort of collaborative approach. But then under a subcontract or a sub-award, they call it, we would implement that here in our local 2 counties with local staff, local volunteers, and very much a local effort.
We passed the resolution yesterday.
Yes, sir. I saw that. Very much appreciate
It's on our agenda Tuesday.
it. Yeah. Well, and the ironic thing is, commissioners, is one of the questions in the grant funding opportunities asks the bidder to explain past experience with this, and our organization has since 2005 been very much engaged in providing unbiased options to people, and under other grant initiatives, including one that then Representative Schaefer initiated. We were a funded pilot project in 2005 for what you may recall, the Southwest Michigan Long-Term Care Connection. So we had options counselors. We did this work. We partnered with our disability network of Southwest Michigan friends, developed those communications and protocols. So it's really just re-emphasizing a lot of the work that we all do. We want to have a greater presence, and this grant would allow for the disability network to be down in our 2 counties more than they are currently. And we welcome that because it will give people with disabilities who aren't quite 60 yet that would be eligible to talk with us or to work with us more directly, to have that just that unbiased touch and to be able to understand their options for long-term supports and services. So,
Well, very good. We appreciate that. Any questions for Laura? Thank you so much for that report. We appreciate it. Tell Ashley we missed her, but we understand.
he's probably watching. So,
All right, moving on. Financial reports, page 34. Miss Tracy.
Yeah, so good morning. I wanted to take a minute to let you know that our new accountant is really coming along. And, you know, her training has been slow because we've been learning a lot of things that deal with the year-end close and the fiscal year, which we only do once a month or once a year. But she has produced the financials for the board, for the October, completely independently this month. So she's moving along, she's making great progress, and I'm able to take a back seat more and just review what she's doing in a lot of areas, which gives me time to do some other things. So that is moving along. In the bills before you, there's just a couple of things I wanted to point out. On page 34, you have a $50,000 under Century MERS. That's the extra $50,000 that we sent to the MERS defined benefit unfunded pension. And then on page 36, you'll see a $15,666 expense to ServPro. That's for the water damage repair in the Hillsdale facility. Other than that, most of this stuff is pretty routine. I would be happy to answer any questions that you have.
Very good. Any questions for Teresa on the financial?
Would move to approve the financial payment as stated for the month of November 2024.
We have a motion. Do we have support?
I'll support that.
We have a motion and support. Hillsdale, heavy motion and support. All in favor, any discussion? All in favor with an aye? Aye. Opposed, same. Motion carries. Moving on, review of financials.
Yeah, so you have the balance sheet before you, and I'm expecting in early January that we'll get this bill from the state that says we have to send them all that money back that they overpaid us, which we will then have to do. But until then, we'll continue to collect that interest money. Your 5-program summary is always kind of a mess in October because we're running off of original budget, which we really didn't, have a great picture when we made the original budget. So we'll continue to monitor all of these programs, and there will be an adjustment to budget numbers once the budget. Be happy to answer any questions you have.
Make a motion to approve the financials as stated.
All right, we have a motion and support. Further discussion? Seeing none, all in favor with an aye? Opposed, the same. Motion carries. Thank you, Ms. Teresa, for that, and for the staff for putting that together. Moving on. Committee reports. Finance Committee. John, do you have an update for our Finance Committee?
Pretty smooth, I think, unless anybody wants to highlight something there, Rebecca.
Nothing.
We have those meeting minutes.
Yeah, we have.
Anybody want to make a motion to approve said minutes?
I'll make a motion to approve. That's the finance committee.
All right.
I'll support you.
We have a motion support. Any further discussion? All in favor with an aye? Aye. Opposed, same. Motion carries.
Good job. You like talk to us about program?
Yes. PPA.
Yeah, seeing how you're at both of them, Tom. Current Policy and Appeals Committee minutes are presented here for your review. We reviewed the personnel policy, which will come up later on. We also had conversation regarding the health officer evaluation. Just something to be forefront on that, making sure that the questions that we're asking are relevant still today in regards to the performance and the duties of the health officer. So we'll continue to work on that as we go forward, but I would move to approve the minutes of Program Policy and Appeals Committee meeting at some time.
I'm gonna support him and say that Brent went over every word, sentence, and paragraph, and paperwork that was signed to us, and it was very thoroughly vetted.
Okay. Well, we appreciate
And I
that
can vouch for that.
thoroughness. So I appreciate that. All right. We have a motion to support. Any further discussion? Seeing none. All in favor with an aye? Opposed, the same. Motion carries. We have no unfinished business. We just take care of business while we're here, which is a good thing. On to number 9, new business. We have the budget amendment number 1 on page 42. Ms. Teresa.
Yeah, so before you is budget amendment number 1. This gives us a much better picture of what we're expecting for the year. And currently, the estimated expenses that we anticipate are $9,499,683,000. And we do have all of the funding that we need to support that budget. But I did want to point out that there is some fund balance use in this budget And the fund balance use would be $310,000, $310,378. And the majority of that money is prior year money that can only be spent in certain applications and programs. So we're trying very hard to use some of that money and spend some of that down and get that money spent. That being said, we do have a very conservative budget style. So it is likely that we would spend all of that, but we could.
But we're still ending the year here based on this projection at 3.25 million fund balance
Yes.
on a $9.4 million budget.
Yep. Any questions for Teresa on the first budget amendment?
Teresa, what is our fund balance policy for?
It'd be 2 months of operating expense.
Which obviously we have. That would be satisfied. We're good. Any other questions? If not, I will entertain a motion.
So move to approve the amended budget as presented.
John with the support. We appreciate that. We have a motion and support. Further discussion. All in favor, then aye. Aye. Opposed, same. Motion carries. Thank you for that. Moving on to B, wage scale, page 58 in your packet. And Miss Teresa, is this you? Rebecca, who's this one? We did go over this in finance. So we talked about this. Looks like it's 5%.
There's a request for 5%. Teresa did the lion's share of the work on that, so I'm happy to let her cover it. You know, we do share a lot of information. You know, we've shared most of this in the past. It is an indication of where we rate with regards to other local health departments as well as inflation rates. And also we talk in the written part here about our employee satisfaction survey and results from that, and the comments we get with regards to staff who feel that that their particular position is not funded where it should be. So, more would you say?
Yeah, so I mean, we want to make sure that we don't ever let our employees fall so far behind and get back into the situation that we had going on. We want to make sure that we're trying to keep up as best we can, but within our budget of, you know, allowances. And we feel like 5% will help us stay there. We're basing the 5% based on a 3% inflation rate, but also on this wage study that was done in May of 2023. So way back in May of 2023, which was a year and a half, a little over a year and a half ago, this will put us in line with, you know, kind of where we could be a year and a half ago. It doesn't put us in line with what people are doing today, because I don't know what they're doing today. I don't have a more current study to pull from, but from what we're hearing from their health departments, you know, they're getting increases. They're I heard that even like the nurses in Kalamazoo County are making $50 an hour, which is much more than what. And they've, in Calhoun County, I know, they increased a lot of their wage scale because they needed to increase their nurses. Now, I understand that this is not Calhoun County, it's not Kalamazoo County, but we do want to be competitive against other agencies that are around here and other health departments. So we are asking for 5%. We can afford it, and we want to keep from falling down into that.
And that is in the current budget, correct?
Yeah, that is in the budget that was just passed.
That was passed, okay.
What you guys?
So we discussed in the finance committee, very similar to what Teresa was talking about. And also really, I think from our standpoint in St. Joseph County, it seems like it's pretty much on par with what we're doing as well. We have had inflation out there. It feels like the wage study dictates that, like Teresa said, this is the 2019 as opposed to like where we're currently at, obviously in 2024. So, I mean, we, sent it up to the full board, and I think we passed a recommendation to pass it, didn't we? Yeah. So
Plainview County, you guys are giving a 5% wage increase across the board.
we're talking about,
A little more than that, actually.
we're talking about.
Bumping some dollars and
We had a wage study done also.
What Branch County doing? Sullivan County did it 3%. Sorry.
that's okay.
Yeah, go ahead and take it.
Go.
We did 3%, but also in our wage schedule here, somebody on their anniversary moves up a step, which is another just over 3% wage increase. Tulsa County, we have that same thing. We applied a 3% change to our wage schedule. January 1st, we changed everybody on their step on January 1, not on the anniversary date. So in addition to the 3% adjustment to the rate, they're paying that 3% or 3.125% increase by moving up a step. In 2019, when we did the wage and compensation schedule, was done by a municipal consultant.
Thanks, Joe.
They didn't just look at wages; they looked at multiple things. And wages are not the only thing when it comes to compensating employees. Health insurance, other, fringe benefits, those types of things. In 2019, that report, our individual health rate was 11% higher than all the other counties that we were compared to. And our family rate was 13% higher than what everybody else was compared to. Now, we've made some changes to that since then. We don't have all those numbers to compare. We can't just say, well, we've got to keep up wages, because there are other things that come into play in that as well. Of those comparison counties in 2019, 7 of them, the employees work 40 hours a week. Our employees work 37 and a half hours a week. There is some give and take there. I would feel much better with the 3% wage increase as opposed to the 5%. And, and right, we got this report from Municipal Consulting a year ago. Unfortunately, that report just looked at wages. It didn't include the information regarding, those other fringes. And, those employees of ours, and I know that this number keeps shrinking, that are still on the defined benefit plan, are capped at 3.3% of their wages are required to be contributed to the DB. Some of those other counties that we're comparing to were 7 to 10%, or one of them was 7 to 10% of the wages have to be contributed to the defined benefit plan. So, okay, yeah, they're paying them more, but they're taking 10% of that wage and it has to go into the defined benefit plan.
Well, we talked in St. Joseph County about exactly what you're talking about, as far as, because we get this thing where we look at these wage studies and we're like, man, look how far our employees are different than the others. And we're like, well, that's because in past negotiations, we've, instead of increased pay, we're like, hey, you can have
more
this
time off
or you can have this, that, and another thing. And then ultimately you get to a point where employees are like, and it's a valid argument, they are getting underpaid. That's why we're trying to get Teresa to make sure that she negotiates on wages more than anything, so that we don't get this thing where 10 years from now, we're like, how far back our employees are,
If
but
you give
don't
more,
take into
if you give
consideration.
more in wages, they're gonna take back more in, in some of those additional benefits that you granted over the years.
That's true too, but I mean, I think in the last 5 years, we can all agree that inflation's really outpaced the pay scale.
Yeah, I think that's valid.
And if you give them more time off instead of an hourly rate,
Right.
they can't afford to take the time. It's not making enough money to utilize those extra days to give them
we just as soon not give them any of that, just give them the wage, so that, like Jared said, because otherwise, 3 boards down the road, they're gonna go, well, wow, how you were so, what are we doing here?
Well, unfortunately, unless the legislature changes it, for every hour worked over 30,
Yeah.
or for every 30 hours worked as of February 20th, they earn an hour
Paid sick time.
of paid sick time, and that paid sick time is uncapped.
But I thought that wasn't that a resolution that was voted on?
No, remember, this was back 2 years ago, 2.5, longer ago than that, 2018, I believe. There was a voter initiated referendum. The legislature enacted it and then amended it during the lame duck session that year to take it from, what the legislative initiative would have been to not requiring the unlimited overtime, only requiring sick pay for over 50 FTE employees, multiple things. The Supreme Court ruled, earlier this year that was unconstitutional. So now, February 20th next year, we're gonna see the elimination of, work to eliminate the tipped wage credit, the increase in the minimum wage and the, that mandated sick time. So, carryover, which is, we can put into the personnel handbook that's for today, hoping that the legislature will make some modifications to that here in the next.
Yeah, I think everybody's hoping for that.
We looked it over, and I think 5% is within the right margin. Budget, they understand that this is a limited budget, that we don't make the budget next year, we're gonna may have to make some cuts. I move that we do accept the 5%.
I will support that.
All right, we have a motion and support. Further discussion.
Tanner, can you make that effective January 2nd? From a payroll standpoint, that makes me. So it'd be great.
And that's what you just said.
To January 2nd, yes. Steve,
I will.
and your support, okay. So we have a motion on the floor for a 5% increase, effective January 2nd. Further discussion. Okay, all in favor with an aye? Aye, opposed, same?
Aye.
Motion carries. Good discussion, guys. Okay, moving on, C, 2025 Board of Health meeting schedule. We also went in depth on this, in the Finance Committee. And we came to 0 resolution, which is a good committee.
So just as the January date is wrong on this paper. It's been corrected on the website, but it was already printed. It's actually January 23rd for the board meeting of the typo.
And Commissioner, I believe this does include the committee meeting for the month of January. At the Program Policy and Appeals Committee, we talked about this, and I said it's easier to cancel them if you don't need them than it is to need them and not have them scheduled to have. Mr. Chairman, you'll retain the chairmanship of the Board of Health after January 1st, up and until that January 23rd Board of Health meeting.
I'm getting booted. 23rd.
Maybe.
You don't have to.
Yeah,
23rd.
Booted on January 23rd, according to the.
Hillsdale will riot.
No. Whoever you bring along with you, John.
Oh, that's fine. So January 23rd is a full board meeting. And you're saying to continue to have on the books at least the committee
meeting.
meetings.
Because if need be, as the chairperson, you could make those, whoever you guys appoint to the Board of Health and whoever Branch County appoints to the Board of Health, hopefully,
Yeah.
3 of us at least return. But you can designate those other individuals to whatever committee that they're going to go to.
Are you saying that?
Rick,
Oh, is he really? I didn't know that. I'm always the last to know. Okay, so we can keep it on the books, and then honestly, we're more than likely going to cancel that because we just
I lose no sleep over.
Yeah.
I did go back and I looked at this year and I think, we canceled our February committee meetings last,
Yeah.
this year, so.
Right. Okay.
Well, then we'll probably have to be PPA because the changes to the sick time
Yeah.
thing.
Right, cause we followed that.
Unless it changes in their book. And then just to point out, the finance committee, that 17th of January is a Friday. And that's because of Martin Luther King Day. So the meeting was moved to Friday, in recognition of the fact that there were closures on Monday.
It's
Okay.
the same with the February meeting because of President's Day.
So
But-
just wanted to point that out.
And then again, once we get new members on this board, those dates may not work for everybody that would be on those committees anyway, so we may need to make adjustments
We'll cross that bridge when we get there.
for the health schedule
Yeah.
in the future.
So I'll keep in touch with you.
Okay.
We'll decide to do with
Sounds good.
January as the dates get close.
I support your make pretty decision.
And I would move to accept the Board of Health meeting schedule 2025 as presented.
The change of the 23rd of January.
Yes.
With the change of January 23rd. Rusty's boycotting. We have a support. We have motion and support. Any further discussion? All in favor with an eye?
Aye.
Opposed the same. Motion carries. All right. Put that on the calendar.
It's my Commissioner Liniger, you had mentioned something about the board needing to take action to grant the chair that approval to.
Yeah, current bylaws say, so I would move that the chairperson have the authority to make appointments to the Board of Health committees in January as needed.
The power may go to my head.
And I would say January 2025.
You don't want to do. You don't want to do any January going forward. All right. Motion on the floor. All in favor with an eye? Aye. Opposed the same.
Maybe we can discuss about bylaws and who's the chair.
Motion
Just keep it
carries.
as you.
Yeah. No.
You-
That's all Branch.
Can't do that.
That's all Branch County.
Bylaw.
We won't get into that.
Yeah.
All right, moving on. Personal policy manual, page 64.
We discussed this at the Program Policy and Appeals Committee meeting. You'll notice in there, and regarding the table of contents where you see stuff crossed out and changed there, a lot of that will not actually be changed in the final document. It's changed here because this is a trying track level change, so it shows, as you get into the policy, what's in blue is crossed out, what's in red is added in. With some spots, other spots, what the blue is added in. How do we do that?
Blue's old language, right? That's,
No.
Well, the red is out, blue's in. And we
On some spots, it's red's out, or red's in, blue's out, other spots, blue's in.
It depends on who made the change. There were three
We
different
went over this, we're letter by letter and everything, Brad.
people that needed the document, depending on who that.
But then it should be green, right?
I would imagine if it's lined out, that means it's out.
If it's right, line down, it's out.
Regardless of the color. I'm colorblind anyway. So it
You're
doesn't
too
matter.
busy looking at the bylaw.
So,
So any highlights? Commissioner Leininger, I'm obviously just looking at,
we're gonna readdress it strictly.
yeah. On the legislature gets off their duff and does something about it.
okay.
Do you know anyone up there?
He knows everything up there.
Maybe next year, huh?
All right. I will entertain a motion.
I would move to approve the revised personnel policy as presented.
Steve? John?
Yeah.
Rusty's boycotting. So John. Second set. We have a motion and support. Further discussion. All right. Seeing none. All in favor with an eye? Aye. Opposed, same. Motion carries. Good work on that, guys. Tabled items. Hillsdale Water Soft.
that I will bring you information in January. We did collect a couple of water samples. And then, as I had mentioned, I think at some point somewhere, we're working with MCBC in the Hillsdale location to ensure that there isn't any concern or potential damage to their equipment. So I'm not ready yet. We're waiting for Jose.
Okay.
We did correct some of the wording on that for insurance.
For the water line.
Okay.
Didn't have a flood until you had water damage.
You most certainly did.
I'll take your word for it. From my insurance guy. All right, very good. 12. Before I adjourn, keep in mind, obviously, the upcoming meeting minutes or meeting dates that are on the schedule. We'll keep everybody posted in January. And everybody have a Merry Christmas. Oh,
Yeah.
public comment. I'm sorry. Public comment.
Go.
Hit us. Nothing?
If
All
I
right.
may,
All right.
Yeah,
if I
we
may,
got something.
Commissioner comments.
just want to thank Mr. Lanius, Commissioner Baker, Commissioner Matthews, who's not here, for their service on the Board of Health. You know, and when we get elected to serve on county commission, some of these other committees we're not necessarily planning on when we get on that Board of Commission, but it is something that's vital to the functioning of local government. So thank you for your 2 years of service in town. It is 3.5.
Yeah, something like that.
And I'll finish with this. Is there anybody on the line?
There's no one.
Gosh. Thank you, Tom.
If you could take a photo, we would like to at least recognize you also publicly that way. So if you wouldn't mind, then you could gather by the cake and then.
Good. We have a motion. We have support. All in favor of the aye.